We have Senator Jerry Butler and again with Minister Mary Butler. Senator, you've got 4 minutes.
And welcome to Minister. Minister, the issue of public health doctors is a very important one in our community, notwithstanding the remarks that Senator Mullen just made in his contribution. There have been numerous reports recommending a restructuring of public health, and they are awaiting consultant status to specialists in the public health medicine scheme. The Crowe-Howard report is the most recent report commissioned and published in January of last year, and that was seen as being the roadmap to which progress could be made with the Department of Health in the road to parity of esteem and in terms of positioning for public health specialists. I think we all agree that a highly functioning health service must be underpinned with a strong investment and a strong commitment to public health, and our public health doctors are one such pillar of that construction. They are doctors who specialise in public health, who have in many cases swaths of population as their patients. They investigate the health status of their population, of their patients, using bespoke health information system, evaluating the evidence for redressing the poor health status, designing the requisite improved services, and evaluate the efficiency and effectiveness of public health services that are targeted towards particular diseases in population groups. They are a very important pillar of our public health model, and if we're to look at the whole Sláinte care, it is identified as a key component of Sláinte care, a strong public health function, as a key enabler in its reorientation of the health service. Minister, my commencement matter today is based upon the talks that are taking place between the public health doctors and the Department of Health. I, as a former chair of the Health Committee, am firmly aware of the work and of the role of our public health doctors. I think we all agree, Minister, we need a public health medical structure that is fit for purpose, especially in a post-pandemic Ireland, given that we are committed to the implementation and the funding of Sláinte care. The tackling of health inequalities must begin, in my opinion, with our public health doctors. I know there have been talks. I know the progress of these talks are slow, and I'm concerned as to what's happening at these talks, Minister, because all of us recognise that if we are seeing reform in our public health system and reform in our public sector, then the new consultant position and the new consultant posts for public health doctors must be given parity with their colleagues. Minister, we have had many reports commissioned, all recommending a restructuring of our public health and the awarding of consultant status to specialists in the public health system. As I said, the Crowe-Howard report and now the talks are the next stepping stones. So I'm asking for an update on the talks today. I'm asking that government will be committed and will commit to the parity that public health doctors deserve. And I thank the Minister for being here. And I just want to add one sentence to Senator Mullen's contribution. What he's saying is quite correct. There is a need for all of us to be very vigilant and to be very supportive of what Senator Mullen has raised as part of his report. We've seen in the summer and in the first period, in the first phase, fatalities and deaths and illnesses, and the vaccination programme should take cognizance of what Senator Mullen has said.
Thank you, Senator Butler. Minister, you've got 4 minutes to reply.
Thank you, Cathaoirleach. So I respond to this on behalf of the Minister for Health and Minister Stephen Donnelly. So I welcome the opportunity to address the House on this issue, and thank you, Senator Butler, for raising it. First and foremost, I would wish to express my sincere gratitude to our public health doctors who have been to the forefront of our response to this pandemic and have made an enormous contribution to the protection of everyone living in Ireland. This government has already shown it is committed to investment in our public health workforce. The Minister has already committed to significant investment in public health, with the announcement of plans to double the current workforce by recruiting an additional 255 permanent staff at an annual cost of over 17 million. This includes public health doctors, nurses, scientists and support staff. This is not only a response to the current pandemic, but is an investment in the future development of our public health function. Recruitment for these posts is a priority for the HSE. Senator, a significant body of work was already underway, but the pandemic has certainly highlighted to us all that public health medicine must be reformed and strengthened such that the skills and expertise which are unique to public health physicians can be leveraged to ensure maximum return for the Irish Health Service and ultimately benefit and improve the health of the population as a whole. The Minister has been very clear and consistent on his commitment to delivering on the recommendations that were made, as you referred to, for public health in the Crowe-Horwath report. The report recognised that the very important role that public health medicine plays in the health of our population and in how our health service is managed and delivered. Officials from the Minister's Department, in conjunction with the HSE, have completed a substantial amount of work on a detailed framework for the future public health model that includes consultant-level roles. A process of engagement has begun between Health Service Management and the Irish Medical Organisation. So the Department of Health and the HSE met with the Irish Medical Organisation on Wednesday the 27th of January 2021 and again on the 3rd of February 2021 last week. The Department hopes that engagement will continue over the coming weeks. An engagement with the Irish Medical Organisation is ongoing, so the Minister has stated it would not be appropriate for him to discuss the specific details at this time. But just so that you will know, they have met twice, and the appropriate levels of communication are ongoing.
Thank you, Minister. My information, ministers, that talks about are at an impasse that the IMO have walked out. The Crowe-Horwath report stipulated that the training of the cohort of specialists in public health medicine is of a standard recognised internationally and equivalent to other medical specialities. Minister, and I appreciate your commitment, specialists in public health medicine and medical officers of health are responsible, Cathaoirleach, for the health of the population, and we as a government and we as a parliament must afford them the same contract as their health colleagues in hospital consultant posts, who have the same level of qualification as they do, which enables them to have the requisite authority to do the job properly. And we must empower and recognise and give status. And we must also deliver the same appropriate number of staff with a range of skills and competencies in multidisciplinary teams. And if Minister Michael McGrath yesterday has talked about increasing the public sector pay bill, then Minister Butler, I hope you will join, and I will work with you to ensure that we look after these group of people who are now so pivotal in a post-pandemic Ireland. I'll finish in this sentence, Cathaoirleach. This is about specialists in public health medicine in our communities.
Thank you very much again, Senator, for raising this issue. And as I have said already, an engagement with the IMO is ongoing. I'm not privy to the details, but I'm sure you would join me by saying that the best way forward for any discussions when you get two various groups around the table, communication is essential. And I suppose the only way that any solution can be found, regardless whether it's education, whether it's health, whether it's business, you have to talk, you have to sit down. I just want to say again, the introduction of the consultant-led public health model as recommended in the Crowe-Horwath report is an immediate priority for the Minister's Department. Our public health specialists, as we all know, have been to the forefront of the response to the pandemic, and they have given tirelessly in response to this very dangerous virus. We want to make sure that we work closely with the public health doctors and to put in place the best public health structures going forward. We want this to happen because we want to ensure that public health medicine is an attractive career choice for anybody who is considering medicine as a career. So just to conclude, I think it's very important that all sides, get together and try and move forward, because that's the only way that can happen. Gaurav Mahagut.